There we go. Now it says it's recording. Okay, welcome everybody. Thank you for attending this bright and early K&M Casino DBA 500 Club training call. I appreciate you taking the time out of your day to do this. I think I was going to have Mike and Patricia and Jason, if they could share some thoughts and insights about the company, the 500 Club that we're going to be doing the enrollment on. So who would like to share first?
Jason, you want to?
Good morning. Good morning. This is Jason, Vice President of Employee Benefits over at Hub International. This is my account, along with Patricia, is my account executive. I would say the main thing that we want to keep in mind, just a big picture overview, is that this company has gone through some very significant changes recently. They were recently acquired back in March, and they're under new ownership. And the old ownership did things in a very different way. And so the employees are experiencing a lot of changes, and culturally they're kind of, there's just been a lot of things going on. However, the new employer is coming in and they're making a lot of great improvements. So in the communication of these benefits, I think it would be a really strong message if we were able to communicate with everyone that, you know, your employer really cares about you, they care about doing things the right way, they want to offer you this great employee benefits package, you know, because they know that Kaiser's a great carrier out here. They're putting you with, you know, the best carriers for your area, as well as all the Colonial benefits. You know, you have a very robust package now, whereas what you had previously wasn't necessarily such a great thing. You don't necessarily need to talk about how bad the old benefits were, but just I think really if you explain that their current offerings are pretty rich offerings compared to what are other opportunities in the marketplace, I think that will go a long way. Just kind of as an overview, the day that Patricia and I went up there and actually met with the leadership, who is also very nice and very easy to work with, by the way. So you should get a warm welcome when you show up. They were actually painting the building and like going through they're really doing a lot of things overall for the business to improve things. So our main goal for instituting this package the way that we have is really to help boost morale and to help deliver on the changes for the better that the employees should be now experiencing.
Patricia, do you want to pop a few words in? Yeah. Patricia, do you have anything you wanted to offer?
I don't really have anything that I need to add. I think Jason did a pretty good job of explaining it. But yeah, I mean, I think the most important thing to his point is, just making sure that the employees understand that, that the new ownership is certainly trying to give them a rich benefit package. And, that is why we're offering the voluntary plans. And I know, to the point we are getting rid of the basic life, but I think the fact that they're going to see a difference in their medical contributions, that's certainly going to make them happier.
Yeah.
And then they'd have the option, obviously, to buy the voluntary life. So, yeah, I mean, I think Jason said it pretty well.
I want to toss just a couple of notes in. So what Jason was talking about, and he did encapsulate it really well, is the same thing we want to do with every group we always go to, and that is to look those employees in the eye and tell them, you may not know it, but we see every employer under the sun during the course of 1 year, sometimes 100 to 200 different employers in 1 year, benefit plans, and you guys have a rockin' benefit plan. You really do. Your folks are really taking good care of you. That kind of simple messaging, looking them in the eye and conveying that goes a long way toward enhancing that employer's relationship with their employees, gets across exactly what Jason was talking about. And we're really shining the employer star, and that's they're giving us the opportunity to offer our products to the employees, and it's one of the things that we've for 15 years always said that we give back because it's so easy to do, and that's to complement the employer's benefit plan. So Jason, thanks for bringing that up.
But one other thing I'd really like to add to all the partners on the enrollment team is that we're really counting on you guys to help us get great participation out of this thing on our end and on Mike and Andreas, and we've done a lot of work on this client, and we really feel that a better amount of participation is going to go a long way to communicating that message back to the client that these benefits were well received from your employees, and here's the result. So we would really like to deliver them a good result on participation. So that's what we're hoping for.
What's the participation number today going in, roughly?
Well, they have 240-ish employees, and they've got 37 on the plan. So
it'd be hard to make that better.
A lot of the people that are going to be waiving are probably going to be Medi-Cal employees. And so those we know they're not going to leave their Medi-Cal. We don't expect them to. But there's probably a lot that are either in covered California or just declined because they didn't want it. And those are the ones we really need to try and capture. The ones, especially the ones that are on covered California, because two things that we really need to communicate to those folks is that, number one, they're no longer eligible for that subsidy with covered California. And if they keep that subsidy going while their employer has offered them a plan, they will be overpaid and they will have to pay that money back to the IRS. Can't impress enough how much we need to communicate that message to those folks. The other thing is those that have just declined, they may have just felt like the plan wasn't good enough to pay for last time. And as Mike mentioned earlier, the employer's contributing actually an additional $90 from where they were just a couple months ago. Previously, they had their old ownership at the old company was giving $130 a month. Now we've had them raise it up to, it's just right at $260. No, I'm sorry, it's right at $210. My bad, $210. So by doing so, they've significantly increased the contribution and they've increased the amount of choices. So now the employees have a base plan that they can buy into, or they can buy up to richer benefits if they want. So, those are kind of the two main messages that we really need to go after those folks that have either declined or
Perfect. So
Okay.
that was really valuable information. So the thing I want to put on the heels of that is, as humans, I've kind of noticed in the 21 years I've been on the ground, that was a joke, that employees are going to focus on, the negative. They're going to focus on the takeaway. So we've got, one thing that went away, and that was the employer paid basic life. Fact is, it was only $10,000 worth of coverage. And what does that cost the employer per month? $2.30, $3, a month per employee, something like that.
Yeah.
So while that is the message, and I don't have the exact number. If somebody does, it might be great. But focus on this employer contribution change. Cost of benefits increases and has every year. We've all got tons of research data on that. Focus on the fact that we've gone from 130 employer contributions to 210. But this is a puzzle that pieces have to be moved around in order to accomplish the best end goal, the best end result. So that's the message we want to get across. And please make sure that it's one of the first things that you do after you introduce yourself and show them pictures of your kids and all that kind of good stuff. Because this culture management is a big responsibility that we have, because we're the ones that are face to face with every single employee during the course of this week. The only other thing I was
going to say the 10,000 AD&D cost $1.60 a month for the employer. And now
there you go. And if somebody says, well, why if it was only $1.60 a month, why didn't you just keep it? Again, it's a matter of moving all the pieces around so the end goal can be accomplished. And so it might.
The best messaging to that actual question, if you get that actual question, the best messaging is they had to contribute all of their, they only have a limited amount of the budget to pay for benefits, and they needed to allocate that, just as Mike said, rearrange it, but they needed to allocate those funds to the medical, because the medical is a mandatory benefit that they have to offer based on the ACA. So the law tells them they have to offer that. So we encourage them to focus their contributions where the law requires them to.
Perfect. The only other two things I wanted to add, and Andrea, you might mention this, maybe not, I just want to make sure I don't overlook it, is that all of the enrolling meetings are going to be held in what's called private dining. So I couldn't begin to tell you where that is in the building, but it shouldn't be hard to find. I'm going to be up there Sunday night, spending the night across the street at the Quality Inn or whatever they've got me set up in. And I'll be there 7:30 Monday morning. And then last is the area of the building that we're going to be in. The wireless or the Wi-Fi is really weak, so hotspots are going to be needed. You know, I know you guys always have them with you, but I'm just reinforcing the need for it. Otherwise, you know, there'll be a challenge with trying to get the software to work. Andrea, I'm done. Thank you.
Okay, yes. Excuse
One
me.
more note, and then I'm done as well. Patricia, when you show up on Monday, would you please talk to Kimberly and ask her that throughout the 4-day duration of these meetings, that they can keep the music turned down in that room. I know when we went in there to meet with them, that was super distracting. And if they could do that, if you can just remember to make that note, I think it will help all the enrollers to do a better job.
Sure, no problem.
Yeah, that would probably be extremely helpful because we want the employees to be able to concentrate on their benefits. I have one quick question. I've seen the address 77W Shaw Avenue as Fresno, and I've seen it as Clovis. What is the correct city that this casino is in?
Clovis. It's Clovis, California.
So it is Clovis, okay. I'll update my guide with that then. I just wanted to just get verification of that. Alrighty, okay everybody, so as you heard, the casino's in Clovis and it's just a casino. There's no hotel attached to it because I think I emailed all you so you could make arrangements of where you were going to stay, because I'm sure nobody wants to drive, what, 4 or 5 hours one way from Southern California each
Andrea?
day. Yes.
Andrea?
Yes.
This is Jason. Just one quick note. The address is incorrect that you have. You have 77.
Okay.
It's actually 771. It's actually 771 Shaw Ave.
Okay, I'll just put that one in there because I guess where I had it written down at 77, or maybe the one was so light I couldn't see it. All right, I corrected that. Yeah. So we want everybody going to the right place. We're going to be enrolling, as has already been discussed, the core and the colonial plans on the EASE platform. I put here what the EASE address is direct for the casino, but you guys are going to be going in as the enhanced enrollers. So remember to go in on your coloniallifeenrollers.ease.com, and then you will pull up the K&M Casino, and then you would be able to access the employees that way. I think generally when you access the employees that way, the employees aren't setting up passwords, but if you get to a page and they have to set up a password, please allow the employees to set up their own password, pass the mouse over to them. All the benefits are going to be effective on June the 1st, so that's why we're trying to get everything done so we can get everything over to Patricia that she needs so that everything can get submitted for these new plans that they're going to be having. We'd like May 24th to be the last day, but we may need this is down in the scheduling. We may need to do some cleanup on May 27th to 28th. I know the 27th is a holiday, but casinos are open on holidays. They don't close. So we would still be able to be there if we needed. And we'll have a call center team available at that time as well. But because we're getting late in the month, we're going to do our best to try to get all employees completed next week when we're out there. I'm going to stick in. I have one benefit counselor who I know has to listen to the training. So I'm going to give the first password right now. I'm going to give the password Lucky. And let's see, the call center dates would end up going to the end of the month if we needed it, but we're hoping not to. Some of our basic account information is here. Our billing control number, which Kimberly will have because that'll be on her invoice, the billing control number and the commission account number, and then the Harmony account number. They have 26 pay periods and 26 deduction periods, so everything will show in ease as biweekly. And there's no sections. Their waiting period is they are the first of the month following 60 days. So, and that's for that's going to be for open enrollment as well, correct, Patricia? We don't want anybody to enroll if they haven't reached their 60-day mark.
Yes, that is my understanding.
Okay, and then it will be the same for new hires throughout the year. They need to work 30 or more hours to be eligible for benefits. And for our purposes, part-timers aren't enrolling, so it's just the full-time employees. That's correct, Patricia, isn't it?
Yes.
Just full-time employees? Yeah.
Yes,
okay.
Correct.
How many hours
for
is
disability?
30 hours.
30. All right, great. Thank you.
Just like I mentioned.
Yeah, sorry.
They are an A risk for the for the disability, but they're special market risk 1 because of the type of business they are, and that means that there's no zero elimination day period, no 0-day elimination periods, which is okay, and max of 12-month duration and max of 4,000 or more for most of the population base. Some of the population-based managers can do more if they want to, but the most of the population base try to stay under 4,000. And Wayne was nice. He waived the 12-month employment guideline, so all employees can enroll. They don't have to be employed 1 year for Colonial. They can enroll right away. There are 2 classifications. Most of the employees are just, regular employees, and like's been mentioned, they will get $210.96 towards the employee-only medical. There are 9 manager employees. They'll get their medical 100% paid of the base plan for the employee only. And that's already been set up in the database, so the correct rates will pull up when those 9 managers sit down with you. Because we're in the state of California, domestic partners are eligible. Do you know, Patricia, if they have to have a registration letter or anything with this company, or do they just cover all domestic partners?
I have not posed that question. Jason, do you know what they would prefer? I mean, I think that's maybe something we'll have to confirm with Kimberly.
Yeah, I think we should confirm with Kimberly, but typically the carriers don't require one. So, and we try not to encourage that just because of the fact that then there could be a reverse discrimination claim because somebody's requiring the domestic partner registry, but they don't require marriage certificates. So at this point, we're not requiring one. If they go back and say so, then we'll make adjustments. But for this enrollment, I would say no, unless something changes.
Okay, then we'll just say domestic partners are allowed, is what we'll do right now.
Exactly.
Oh, okay, then I'm the coordinator, so I highlighted my name, but I have 2 backups if needed. Mike he's the account manager, he's the opener, and then like you've heard on the line from Hubbard International, we have Jason and Patricia as our broker partners on this case. We have 4 enrollers right now. We have Rodney and Eric, who are going to be there all 5 days next week. We have Susie and Gina, who are able to be there the first 3 days of the week to help. And Eric is our bilingual benefit counselor. He speaks Spanish. Unfortunately, I lost my Vietnamese speaker, and I have not been able to acquire somebody else who speaks Vietnamese who will travel up to the Clovis Fresno area. So if we end up with anybody that absolutely has to have Vietnamese, Patricia, do you know if there's somebody who we can utilize as a translator?
I believe there probably is an employee there that can translate if necessary, but I can also confirm that with Kimberly. That I need to let her know that we weren't able to secure the Vietnamese enroller.
I tried my best, and I thought I had one on Monday, and I was so pleased until he looked at his dates and realized he mixed up his dates. I go, oh man. Gina,
would they be willing to be available for a call?
You know, I can ask that. I didn't think to ask that, but I would think that you're right that he could probably be available for that. So his name is Gene Christopher or Gene Christoph. I will call and ask him if he would be available for calls and can co-browse with employees if they need it.
Just figure that out and try to coordinate a time while the enrollments are going on. That way we could just let we could let Kimberly know that this speaker is available by phone at this time if anybody absolutely needs that Vietnamese connection, so that at least we're putting out the effort, and if they pick them up on it, that would be great. If not, then we're at least showing that we're trying to accommodate at some level.
Okay, I will get in touch with the rep today and see what availability he has, and if he's able to do that. Some benefit counselors have opted not to be proficient in co-browsing and other types of enrollment practices or procedures or manners, and so I'll have to check with him if he's able to do that. Gina, I have your phone number somewhere, but I was tired and couldn't find it, so can I collect your phone number right now?
No worries. 661-665-6544.
Thank you.
You're welcome.
Make sure
and then
I've
we
got
have
that too. I want to make sure I've got that. Sorry, I'm looking up Patricia right now. I'm almost certain I do. No, I don't. Patricia, would you hit that again? 661.
That's Gina.
Oh, that's Gina? How did I get
Gina's phone number I was asking for.
Oh, sorry. Golly, here I thought. Hey, Patricia, since you're going to be up there, can I get your cell number?
That's a good idea.
For me?
Yes,
yeah,
ma'am.
It's 805 366 7689.
Thank you very much. And if you want, my email has any one of my emails to you has my cell number down at the bottom, or I can give it to you. Either way.
Okay, great. I'll look it up on the email. Unfortunately, like I said, I'm in the car, so.
Yeah, no worries. As a matter of fact, I'll just send you one right now, and you'll have it.
Okay. Mike was nice enough to. Yesterday, I was out of pocket most of the day because I was getting here to Colorado and getting a rental car and getting to the hotel and tracking down my daughter. So Mike was nice enough to hammer out the schedule. And as you know, casinos, they're open all the time, and they have a lot of employees that work in the evening time. So the first 3 days when we have all 4 benefit counselors there, we're going to work in 2 shifts. 2 benefit counselors, we're going to do the 8 to 5 shift, and 2 benefit counselors will need to do the 3 to 12 midnight shift. And keep in mind, there's a lot of employees in the evening time, so it's not like you're going to be sitting there with no employees to see, because Kimberly over at the group and her section managers are plotting out the schedule so that all the benefit counselors come and spend the 30 minutes with us to elect their benefits. I will be calling and contacting you to see if there's any preferences of what shift you want to be on. Just keep in mind, though, I need 2 at each shift, 8 to 5 and then 3 to midnight on the first 3 days. And then on the 23rd, when it's just Rodney and Eric, one will have to be the 8 to 5 shift and one will have to be the midnight shift. And then the last day, we're just doing 8 to 5. We're not doing the late shift. So
it'll be both benefit counselors, 8 to 5, yeah.
Yeah, both benefit counselors. Yeah, that's one shift, both benefit counselors.
Yeah.
Just one thing I want to just interject really quickly, just for, especially for Susie and for Gina, if you do work that late night shift, the casino has security on staff. So if you need them to escort you out to your car or anything like that, you can certainly do that. You know, it's a big city in the middle of the night. You don't want to be walking out there to your car. So feel free to ask them to, walk out there if you feel you need it.
Awesome.
And gentlemen, you can ask for that as well. We don't want to discriminate.
Rodney, I think she's talking to you, buddy. Hey, Andrew, before you leave the schedule, so I wanted Jason and Patricia to know that we put this schedule together that Andrea just reviewed on the phone with Manny and Kimberly yesterday. So we walked through the whole thing and made sure that it was what they wanted, because they know when the most employees are on site, and so this is exactly per what they wanted. So it worked out really well.
I saw that email. Thank you.
You bet.
Okay, and I'll resend the guide out. I'm going to add some of the points that Jason brought up and Mike brought up to the guide, and then I'm going to reissue the guide. And after I speak with you benefit counselors as well, and we'll fine tune exactly who's going to be on each shift. Like I mentioned
I thought maybe this is a good time to add this. I was going to wait to talk to you about those forms that I sent over to you, but the enrollers probably need to know this. So there are several of the forms that require a signature. So the goal is that when the enrollers are sitting with the employees, so that the employer isn't having to print out all these documents, is that they're able to have those employees sign for those forms as well. And I indicated on the forms which ones require signatures. So I was hoping that they would be able to handle that in addition to what they're doing.
They should be able to. We're going to capture their signature on all the enrollment forms, the Kaiser enrollment form and the Guardian enrollment form, and of course the enrollment summary will be capturing the signature. I have to call Ease today, during the operating hours, because I haven't loaded documents previously that required signature that were like HR related documents. So, but it's my understanding that the system can handle that. I just need to call and get direction on how to put it in there so that we can capture the signature on those forms as well.
Okay, perfect. Thank you.
Okay. Alrighty, then we have, like I mentioned before, the 2 classifications, employee class, the majority of the employees, and then I just labeled the other one class 2, which is the 9 employees who are managers or higher. Mike was able to complete and get sent out yesterday the pre-enrollment flyer and the memo, and hopefully all the employees are receiving it, because it will remind them to come to their one-on-one appointments with their Social Security number, their dependents, date of birth and Social Security number, and any of that information. We want them to come with that. We were not able to receive a census that included the dependents, so please, you will have to add, when you're on the enrollment screens, click on that dependent page with every employee so that you can capture the dependents that need to be enrolled, who they want covered on their plans. This is I think a good group to have the well cards with, so bring well cards so that anybody who sits down with you, you can give them the well card and they can have another benefit that they can utilize in the arsenal of benefits that are being offered to them, new improved benefits being offered to them by the new owner. Remember to print out the enrollment summary, the election form for each employee, so they have a copy of what they've enrolled in. I will provide you a copy of the Colonial pre-enrollment flyer so that you can have it, next to you, so to give to employees, so that, if they hadn't received it, they'll be able to see what plans are, the voluntary plans that are being offered. Remember, use a highlighter, highlight the word biweekly or 26, whatever's on there, so that they realize the numbers that they see on their enrollment summary are not monthly numbers, but they are biweekly numbers, because we don't want anybody to have a surprise when they get their first paycheck with the new deductions taken out. We received data from the census from Kimberly over at the group, but as per usual, as a courtesy to the employer, please review the profile data if employees moved or anything like that, update the address, update any information that was in there. This is the EASE database enrollment platform. You benefit counselors will not be able to add any new employees. Like if an employee sits down and is an employee that for some reason or other was not on the census provided, you'll have to text me or email me that you have an employee that needs to be added, because you won't be able to add employees to the EASE platform. Only myself, or if you can't get a hold of me, Ronnie is able to add as well. We are doing, and all dependents, like I wrote here, will need to be added, including their social security number. Please don't add without social security numbers. Social security numbers are required for, especially for medical. So we don't want to have to be chasing employees down or to try to get missing information. So please be sure to include the social. Yes.
Andrea, let me interject something. I just sent you a flyer that we use for eCentral enrollment. We typically hand it out. I mean, usually for small groups, but I'm going to send this over to Kimberly, and I'm going to ask her to make this available prior to the meetings, because it is it's something that we've developed in order to give to the employees so that they know when they come to these meetings, this is the information they should have with them. So I think what you're touching on right now, we're going to try to cut that off on the front end. It will still be an issue because there will still be some employees that show up without it. However, we're going to try to mitigate that.
That would be great. And I know that was on some of the pre-enrollment communication that Mike sent over as well. We always like to send that reminder form with that can be given to employees to come with this data. Okay, the one-on-one enrollment, per usual, Mike we have some requirements on brochures that you should have, that you need to give to the employees if they elect any of the Colonial benefits. Please, have your Colonial Life folder and your business card so that employees know who to contact if they have any questions afterwards. Have the well card, and there's certain flyers that we like to have available for the employees, the taxability flyers, the service guide, the request for service, and then you all need to have your brochures. So we're doing the group accident, and we'll go in more in depth on these products in a little bit. We're doing group accident, group critical care, group disability, and Term Life 1000. I think I sent over to you those products so that you could be sure you had brochures before the enrollment. And you all should have Mike's survey form, but just in case, I'll resend it to everybody. And we like to give that survey to the employees so that they can, it's like a little report card, and employers like the fact that we provide them with feedback on the enrollment using the survey.
And Andrea, if I could just add to that, we also will have supplies there as well. So Kaiser sent up supplies as well as Guardian, so they'll have printed information on that. And we also prepare a personalized benefit guide, which I need to email over to you because I'd like it to be attached just in the documents in East Central, so if they ever need to access it. So those will be there as well. And that benefit guide breaks down, kind of gives a little breakdown of all the benefits offered for the medical, dental, vision. And then it also has some of the annual compliance notices in there. So all that information will be there in printed form as well for the enrollers to share with the employees.
Perfect. That would be great. That's what we need, because the benefit counselors, they come with portable printers and they're not able to print out page after page of SBCs for employees as they sit down. So it's great that information will be there. I think we touched on the password before. Be sure you're on time. Allow enough time to get there. Like Mike mentioned, he's going up on Sunday night. I'm not sure when you guys are going, but be sure to allow enough time if you are the 8 o'clock in the morning shift that you're there 15 to 20 minutes before 8 o'clock, because we want you to be able to get over to the dining room that Mike mentioned, where you're going to be setting up the private dining room, and able to be ready for your first appointment at 8 o'clock. There's not going to be group meetings. They're just setting up the one-on-one meeting, so all employees have a one-on-one appointment with one of the benefit counselors. So if you think you're going to be late for any reason, please let me know, or please let Kimberly know, because they're expecting you at the start time that we've set in the schedule, because there's going to be appointments ready to go at the beginning of your enrollment shift. Everybody, we have a communication platform that's called Slack, and I've sent out the invites for the benefit counselors to join, so that if there's any urgent needs, you can use the Slack venue. It's like texting, but it's a different platform for it. You can attach attachments if needed to it, so it's very handy. Gina and Eric, you should have received your invite sometime in the night of that, so please accept it so that you're added to this communication platform. I was putting the dress code as business casual. Patricia, Jason, do you have any insight on how the benefit counselors should dress while they're there?
I think business casual is fine.
Business casual? Okay. I don't think you need to. Yes.
Before you go on, I want to get back to Slack. So for the folks that are new to us requiring Slack, it is a requirement. It's not an option. It's not a social media platform where we all get to, we all share our pictures and our kids and our dogs and our swimming pools and all that kind of good stuff. It's our primary platform for communicating. So think of it like a blog. So everything that's posted, everybody receives. And that way we can share information. So if there's a software thing or a glitch or a fix or something or an instruction that's being conveyed to everybody, it shows up. You can also put it on your phone. So that way you can get alerts on your phone. But we believe that the best way to use Slack is to have it on your laptop. That way, if the employer walks by, or if our broker client walks by, and they see you toying around on your phone while an employee's sitting there, no one thinks that, first impression is that you're, doing something personal and wasting the employee's time. So there's a couple of reasons. This has proven to be an excellent communication tool for managing enrollment. So I wanted to get that out there for the new users of Slack. And then before I go, Susie put up a question to you and I on email just now. She said on the last two groups she did on ease, the summary had to be printed before the employee signs. And of course, if it's before they signed, it does not show total deductions. Can we address this, what we know about that?
I was not aware of that, so I will make that, because I'm calling ease today. So let me I'll have to ask that question, because I was not aware that there was an issue with that. I knew there was when they did their update, but I thought all that had been corrected. So I will ask about the signature and when the print. going to print the summary, and then I'll let everybody know.
Yeah, get a Slack update out to everybody.
Yep, that's right.
Awesome.
Except I see that Gina and Eric, you still haven't accepted, so be sure to accept the invite to Slack, please.
Will do.
All righty, so I'm going to highlight and bold this next one on here because Mike has already addressed it. Air cards or hotspots are required because there's weak internet where you are in that private dining room. So Ease is an online platform. There's no option to download it offline. So please, you don't want to sit there with the whirly circle as you're trying to work through spotty internet. So you want your 30 minutes to be able to function nicely. Be sure you have extension cords, the usual, your printer, your ink, since you're going to be, basically, right one after the other, employees are going to be sitting with you, so you don't want to run out of supplies. I've added everybody to the enrollment platform. Enhanced enrollers don't have the ability to access a test employee, so I'm going to create a live employee that's called Test that you can use. I just ask that you use it to look at the database, but don't, since it's a live person, always click out, don't go through and complete any applications or anything like that, especially when you sync over to the Harmony platform, because Harmony is going to be thinking it's live and a live employee since it's not labeled test employee. If you have any issues with Ease or anything is going on, especially the first day, use Slack, call immediately. Don't let any problems linger. We want to be right on top of the situation so that the enrollment will go smoothly. So if you notice a issue, just call immediately so it can be addressed. Remember to keep your phones available so you can, if you have Slack on your phone, so you're able to get any Slacks or texts, but please don't take personal calls or anything in between employees because you think you have a few minutes. Just wait until the end of your shift or before your shift. And in the per usual, the usual instructions that we have to remember to return all your phone calls or your text emails from employees for any underwriting things. Be sure that you handle everything. Don't talk about other clients. Don't talk about other plans. We want to focus on this group and the plans that they're offering and how they're improving the benefit offerings. The new owner is improving the benefit choices for the group. I had started putting some key points to tell all the employees that the employer wants the best in benefits for them, which is why they're making the changes. And I'm going to add to this section some of the points that Jason had told us and Mike had told us, and that they have, putting in place what they feel are better medical plans through Kaiser and the better dental and vision plans through Guardian and better supplemental life options through Colonial. And I put the one takeaway down here at the bottom, and I'll expand a little bit more on how they're having an increased employer contribution towards their medical, which is more important or is more useful than is monthly for employees, especially if they have dependents that they're covering. But so I'm going to add a few information there. Okay, now we get to
I think you can just put that it's required by law. Just put that it's required by law.
That's right. Yeah, I have.
They don't feel that the employer is making they don't feel that the employer is making a differentiation, but that they're doing what they have to do in order to meet the law.
Right, so required by law. I have that note there that I'll be doing that. Okay, now we have come to the 3 Kaiser plans that are being offered, and I put down some what I thought was important. But Jason, Patricia, if there's anything else that you think that needs to be here, please let me know, and I will add that information to the to the guide for the benefit counselors. Well, Patricia can't see, so I'll read what I have here.
Scroll down just a little bit. Hold on a second. Scroll down just a little bit.
Okay. I was going to quickly go through.
You have no deductible on the HMO XD plan. I thought that was a $3,000 deductible.
Well, there's annual deductible, and then there was out-of-pocket max, and I was pulling up based on, let's see, so let me pull up here.
Yeah, all three plans have a deductible.
Yeah, we should have a
500, a 1500, and a 500. Exactly.
Yeah, because a zero deductible is not going to be the base plan.
Okay, so this, oh wait, this is.
There it is right there. It has a 3,000 deductible, but no RX.
Oh yeah. I'm sorry about that. You're right. This was, I don't know how the none got there. I had started putting it in there, and then I went and corrected the other ones and didn't get it there. You are correct. Yeah.
That's fine. That's the purpose of this call, that we cover this. It's 3,000.
Yep, thank you. 3,000 individual. 6,000, yeah. And then they're out of packet. Okay, so yeah, there we go. They didn't have a RX deductible. That's the one I was fixing there. Okay, so the base plan, it's the least expensive plan, so obviously it has the higher deductibles. They have the 3,000, 6,000 annual deductible, and then out of pocket max 6,000, 12,000. The doctor's office visits is higher, $40, and then they pay 30% towards their outpatient hospitalization and emergency room. There are prescription copays with $10 generic, $30 brand for a 30-day supply. Was there anything else that you thought would be an important point to address on the base plan?
I think maybe lab and x-ray. That's something that people tend to use a lot. Jason, what do you think?
Yeah, that's fine. I think those are subject to the deductible on that plan. So that's fine.
Yeah.
Okay, so I'll add lab and x-ray in there. And it looks like the labs and x-rays are $10 after plan deductible. So they have to meet their deductible first, and then it's $10 or 30%. So I'll add that in there. 30% co-insurance. Excuse me. All right, and then they move up the next plan, which is the plan 8814, and it's costs a little bit more for the employees, so they'll still get the 21096 off the employee cost, but this plan is a little bit richer, 1,500 individual, 3,000 family for the annual deductible, no RX deductible. Out-of-pocket max is 4,000 or 8,000, and their doctor's office co-pays are $20, and they're in urgent care, which is nice. And hospitalization is an outpatient in an emergency room, or 20% after the plan deductible is met. And they're also $10 generic, $30 brand for a 30-day supply of the prescription drugs for generic and brand. And I will add the lab and x-ray to this one as well. The last plan, which is the most expensive plan, their annual deductible is just $500 for an individual, $1,000 for a family. There is a prescription deductible of $100 for each family member. Can you
double check that? Can you double check
Sure.
that there's certainly I thought there wasn't one, but maybe we looked at that wrong plan.
Right here, drug deductible, $100, and $100 for, and then it's not applicable, it doesn't cap out, so it's Looks like it's $100 for each family member. And then then the rest is similar to the other plan. Their out-of-pocket max is less, $3,000 for an individual, $6,000 for a family, but their doctor's office visits and urgent care is still $20, and then the rest of it, outpatient hospitalization, employer copay is 20% after the plan deductible, but their prescription was $10 generic, $30 brand for a 100-day supply, so they get more drugs for the money. Was there any other thing, and then I'll add the lab and x-ray to this one as well. Was there anything else that you can think of that differentiated the plans?
Hey, Andrea, before you guys answer, I have a 7 o'clock call that I have. It's going to last 2.5 hours that I've got to jump to. I've gotten all of my announcements out. If there's anything that comes up after my departure, if you just let me know. But listen, you guys are going to be great. I'll see everybody, or Patricia, you and everybody else up there on either Sunday night at some place to eat, or on Monday morning.
Okay.
Thanks, Mike.
Thank you, Mike. And
all right, thanks.
And while he's jumping off, I'm going to add my next password. It's going to be day. So now we have Lucky, and now we have Day for our passwords for for Rodney, who's going to be listening. So in the meantime, Patricia, can you think of anything else that differentiated the 3 plans other than the deductibles?
I can't think of anything else. No.
Okay. But these are some, like Jason's already alluded to, these are some nice rich plans that are available, and their composite rates are not bad. So, and they'll get $210 off of the employee cost, and the managers will get 100% of that base plan employee cost off of the Kaiser. And so Kaiser is popular up there.
Just to mention that really quick, they're coming off of age-banded plans. So folks that are doing the enrollment, you guys may run into a few employees that are like, oh, these are expensive, but those are going to be from the younger employees. All of the older employees are going to save money. So it's just really, that's because it's just a function of going from age-banded plans over to a composite rate. So I think the takeaway message is that now everybody pays the same.
Okay, everybody pays. That's a good takeaway. I'll add that to our takeaway. Everyone pays the same. No age bands. Okay. All right, then we'll move real quick to the Guardian plans, which are the dental and vision, and these are voluntary plans. The Guardian, the DHMO, the managed dental care, there's no annual deductible. It's unlimited annual max. They'll still pay, 100% basically for most preventative services. And the doctor's office visit copay is $5. They do have ortho on the DHMO, $18.95 for a child, $21.95 for adult. It uses the managed dental care network, and there's so many, so many copays that you'll have to use the schedule of benefits for the copays, and I think I sent it to you all with the initial copy of the guide last night. Is there anything that you can think of that I should specifically put in this list for the DHMO plan? Patricia, off the top of your head, if you think of anything, just let me know and I'll add it.
Okay, I can't think of anything right now, but if I do, I'll let you know.
Okay, and then the PPO dental, the Dental Guard dental, it looked, they had sort of like options under it. There was a Dental Guard Alliance and the Dental Guard Preferred, which corresponds to the network that's used, and then of course out-of-network. There's a third option, but out-of-network is generally not a preferred one to use because that'll cost you the most. But the dental, there was no annual deductible on the Alliance one. The Guard one had a $50 annual deductible, individual 150 family, and of course out-of-network has the same. There's the annual max was 1,500 plus the maximum rollover. They can build up a rollover on these plans. Preventative, of course, is covered 100% on all of it, on all options. Basic, on the Alliance plan, it's 100% covered and 80% on the Guardian, on the Dental Guard one. And the major, oh, I noticed my percent sign is missing here, is 60% on the Alliance and 50% on the Guard. And there is no ortho on the PPO plans, or I don't think that there's ortho, because it didn't look like they were paying for the ortho option. Is that correct? That ortho is just on the HMO?
That is correct, yes.
Yeah.
Okay. And then I'm assuming that because the Alliance plan has higher percentages, that it's a smaller network. Is that correct?
Right, yeah.
So there's less doctor choices, which allows them to make it a little bit richer on the coverages. Is there anything else that you want to add on the dental? And I'm assuming since you're switching to Guardian that the Guardian network is fairly large up in the area?
Yeah, I don't think that would be an issue with networks. They have a strong network. And I don't think there's anything else that you need to add. That was pretty good.
Okay. And then the Guardian PPO Vision, they have a $20 eye exam every 12 months, $20 lenses benefit every 12 months, $150 frame allowance, and then after that, I think it's 20% off the rest of the cost. Every 24 months, they have a $150 contact allowance in lieu of lenses, so they can get contacts in place of lenses, and it's just it's pretty much standard coverage for the dental plan, and we need to let employees. Is there anything you want to add about the vision?
No.
And then, okay, and then we've already talked about the basic life going away, and I'll add that they're required by law to contribute to the medical, so they prefer to put their employer dollars towards the medical. They by law they need to, and that the supplemental they had it through Mutual of Omaha, and I'll be providing the invoice to you so you can see who had supplemental, and they're able to get the Colonial Term Life. Are they going to keep the payroll deductions for the Mutual of Omaha, or the supplemental, or the payroll deductions going to go away?
We're canceling the supplemental life with Mutual of Omaha. So the only thing that's staying with Mutual of Omaha is the voluntary LTD.
So they'll have to convert to individual, pay for it themselves if they're going to keep it, or they can switch over to the Colonial Term Life. Now,
Andrea, can I ask you a quick question?
Sure.
Was the Mutual of Omaha a group term life, or was it an individual?
It was a group.
Patricia? Group?
They had both. They had the group term life, which was $10,000, which is going away, and then they also had the voluntary supplemental life.
Well, the supplemental, was that a group? Was the supplemental life? Okay.
Yeah, it's a group plan, but the employees are paying for it on their own, right?
So it was a group supplemental plan. So now we're moving. Yeah. So now we're moving over to the individual term life 1,000 that they can get. They also have through Mutual of Omaha long-term disability. They're keeping the long-term disability, but the open enrollment for long-term disability is February, so it's not going to be available for this open enrollment. Oh, January? Oh, because it's with a February 1st effective date. Okay, it's January. Okay.
No, it's a January effective date. So essentially, open enrollment is in December with a 1/1 effective date. Yeah.
Okay, okay, so January 1st effective date. Okay, and it's basically 60% of the their salary. The max is $6,000 a month. And I was looking at what you sent, and it looked like it said that the elimination period was 360 days, so basically a year, or because most LTDs I thought are 90 days, and I couldn't determine that from what you sent. So can you verify for me what the elimination period is for the long-term disability?
Yeah, I'll verify it when I get into the office. Or Jason, I don't know if you're online and you can look at the benefit summary. It should be in their folder. But I believe that is correct. But yeah, you can just double check.
Yeah, because I was looking at what you sent, and I was probably being blind, eye blind, and when I was looking through this, I mean, the elimination period, it said 360 calendar days, and I didn't know if that was before they could enroll in it, but I couldn't see any elimination period here, so I'm not sure when, how many days they have to survive before they can start using their LTD. So yeah, if you could check into that for me, that would be great. And that would be helpful for when you sell our Colonial plan.
The elimination period on that plan is the later of 360 calendar days or the date your salary continuation, accumulated sick leave, or short-term disability ends. So that's how they've written that out.
Oh God, I haven't seen it that way before. Well, okay, that's why I was looking at.
Andrea, they're doing that because the state's already giving them 60%, so it doesn't pay them. Right. They have to wait. They have to wait the year when the state stops.
Got it. Okay. All right. We're offering. For now, we'll come to the voluntary plans, the Colonial plans. We're offering the group accident plan, the preferred group accident, or the premier group accident for on and off job accidents, and also including the sickness hospital confinement benefit and $100 health screening. So that's what's available for the group accident. The group disability is off job only, risk A, the 6 or 12 months, and 7/7, 14/14, or 30/30 for the elimination periods. It does include, because in California, the psychiatric and psychological condition. There is the health, I don't think this one had health screening, so let me take that off. Sorry about that, because this is group. And the underwriting guidelines is a guaranteed issue is up to 4,000. But in California, don't sell over 35% if the employee makes, basically more than 21,000, and keep that 25% of the employee makes less than 21,000, because we don't want anybody to be overinsured, and if they're out on disability, have more than they should to go with the state disability. Group critical care, it's going to be the plan 2. I thought I was offering bread here. No. Plan 2, the full option with subsequent diagnosis and $100 health screening. It has a maximum benefit of $5,000 and guaranteed issue is $25,000.
Is that 5,000? You have 50.
I'm sorry, I meant 50. The maximum benefit amount is 50,000. All those zeros, they just get confusing. And then the group term life, I'm sorry, not group term life, the term life 1,000 we're offering, and all the options are available, the 10, 20, 30-year, spouse term rider, children's term rider, waiver premium, additional benefits for accidental death. So it's full underwriting though, so everything is available on the term life that for the employees. And then, do any of you have, you all have enrolled these plans before. Does anybody have any questions on any of the medical, dental, vision, or Colonial?
What's your underwriting criteria when you say full underwriting?
It's not simplified issue. So it doesn't if they get more than 100,000, they're going to have to do parameds and all that stuff.
Okay. So they know they've got guaranteed issue up to that, and then parameds afterward.
Well, there's no. It's just our standard. There's just our standard term life 1,000. There's nothing. No bells, no whistles. There's no guaranteed issue or anything like that. It's just term life 1,000.
So does that plan offer what am I trying to say? The matching benefit, basically, because they were on a life insurance plan before. I guess what I'm asking is, do they have to go through full underwriting if they already had life insurance? Conversion,
I will,
that's the answer.
you know what, that's a good question. I will check with our risk manager, and I'll send him a copy of the Mutual of Omaha invoice and ask if there's any concessions that they can give for employees that are currently covered. So I'll send that over today and find out.
We would really like the employees to buy up to the level that they currently have if they were already covered. If they haven't already been covered, I totally understand full underwriting. That's not a problem. But if they're trying to buy replacement coverage for the plan that's going away, we would like them to be able to do so without full underwriting.
Okay, I will send that invoice over to our risk manager as soon as we finish this call and ask him what he can do for us. And they're usually pretty good about giving us some, concessions. So cross your fingers. I think we should be able to get some.
So let them know that if they can't do it at that level, if they can, just basically ask them if there's a way that we can get, if they can't do that match, then if there is some level of guaranteed issue that they can do without medical underwriting.
Okay, I will find out.
Okay, thank you.
Andrea, real quick, can you go back to the accident plan real quick? I want you to make a change on something, if you will. The group accident, there isn't a 1.0. If you're saying prefer to premier, it's the group accident 4,000.
Sorry about that.
No, that's okay.
Just totally forgot. Thank you.
So they know it's not the older one.
Right. Thank you. Alrighty, and then just the normal things that you all should know. What to do if your laptop computer crashes. Attachments that are going to come. You're going to be getting the medical plan summaries, the SBCs, the dental plans, the vision plans, and then the websites for Kaiser, for Guardian, for Mutual of Omaha, the EASE URL for the 500 Club, and UBIL is just the normal UBIL site. And that's basically it. This enrollment will hopefully go very smooth because they have the group cooperating because they want their employees to be educated. And if you have any questions, let me know. Otherwise, I think this call, we've completed our training, and I appreciate all of you helping on this group. Let's see, the last password I'm gonna give is winner. So we have Lucky Day Winner for our 3 passwords for this training. And Jason, Patricia, do you have anything else that you want to say?
Andrea,
I do, just real quick.
Also give me a copy of that enrollment guide that you're providing to your enrollers.
Yes.
I'd like to have a copy of it too. Thank you.
Yes, I haven't sent it to you yet because I usually like to fine tune it after we have the call because, see, I have a few things I need to add, and then I will get that over to you. And I'm going to I need to double check for Friday when the graduation is going to be over, and then I'll send some times over to you, Jason and Patricia, when we could go through the EASE database. It might be somewhere around 2 o'clock in the afternoon. Would that be okay? Tomorrow, 1 or 2 in the afternoon?
That will work for me. Okay.
That'll work, okay. Because graduation's at 8 o'clock and it's at least 2 hours, and I know we want to take my daughter to lunch and stuff, so I'm looking probably 1 or 2, probably more closer to 2 o'clock in the afternoon, if that's okay.
Yeah, that's fine.
Sure, no problem.
I want to just add one thing. We are absolutely counting on you guys to make this a successful enrollment, mainly because of our schedules and the other work that we've got going on. So I just want to say thank you for you guys being able to participate in this, and also thank you for your commitment to the process. It's not going unnoticed, and you know, we've been very pleased with the way that Mike and Andrea and the team have really come together so far. So we are, you know, looking forward to this being really successful so we can continue the partnership with other cases. But yeah, I absolutely just want to tell the team in advance, thank you for your efforts.
Okay, thank you, Jason. We appreciate those comments. And thank you, everybody, for being on this call. And benefit counselors, I'll be emailing or calling or texting you to find out about shifts. If you have a preference, feel free to email me now, and we'll get that hammered out. And thank you all for being on the call. Appreciate your time.
Thanks very much.
Thank you,
Okay,
Andrea.
bye-bye.
Bye.
Thank you.